I'm going to share with you one of my favorite strategies to improve knee extension. Knee extension is getting that leg straight, and it's called a prone hang. Now, prone just means laying on your stomach. Hang just means letting that leg hang into extension, letting gravity do the work. I'm going to talk about a couple of the things that might get in the way of using this strategy effectively, and I'm going to share this, which is a tool that I use that really kind of gives you that little bit of an edge to make this strategy more effective. So stay to the end. I'll show you where you can get these compression wraps. They've just been incredibly valuable for me, my patients, my practice, and they're really inexpensive. So guys, let's start with a prone hang. But first, a couple of things to consider. If you have problems laying on your stomach, now I'm not talking about sleeping on your stomach, I'm talking about just positioning on your stomach. A lot of my clients are also dealing with conditions related to the low back pain like spinal stenosis. They don't do well laying on their stomach. I never make anybody who has any back issues in the prone position do this exercise. It's not that important. There is no exercise that's that important that you have to suffer through positioning. If you have no problems with spinal stenosis, you have no low back issues, you're comfortable being on your stomach, this might be a great option for you to try. Let's pretend for a minute that I've got a right total knee replacement. I can start using this strategy from day one out of the hospital. Even if I still have a dressing over the incision, even if I still have staples in, and I'll show you a couple ways to kind of make positioning a little more comfortable. This is really a safe and effective strategy from the beginning. If my bed runs lengthwise this way, and I've got a headboard here and a footboard here, what I'm gonna do is I'm gonna turn my body 90 degrees so I'm laying across my bed horizontally. This would be the side edge of my bed. My headboard is there, my footboard's behind me. The side edge of my bed, what I'm looking to do is lay on my stomach and allow my foot and ankle to hang off the side of the bed. Now, if this is just too uncomfortable, let's say you're limited in that knee extension, you just don't have anywhere near enough range to get there, I would scoot up. And so if I flex my ankle, what that allows me to do is it allows me to kind of create a little bit of support. I can also place a little bit of a towel roll down there under the shin, under the ankle. I'm just gonna use a standard pillow. And what I can do is if I fold this pillow over, this can give me a little extra support. Let's say I'm fresh out of surgery and I don't have more than, I'm limited in 15 degrees of flexion. So what I would do, I'd go on my stomach, and now that's gonna give me a little support. But the goal is I wanna have enough of an extension stretch on the knee that it's uncomfortable but not painful. And that's always the challenge, is finding that level of discomfort but not pain. Once I feel like I can progress beyond this, I can do what we call an isometric quad set. So I tighten my quadricep muscle. If you guys can see, I'll try to zoom in the video. You should see that my leg goes straight. And what I'm really doing is I'm kicking down into the pillow as I tighten the front of the thigh, the quadricep muscle. Okay, now, if I do enough that I've progressed beyond that, what I'm looking for now, as we mentioned in the beginning, is I'm down here. I'm trying to let this drop down. One of the things that gets a little bit uncomfortable, remember, you still have a kneecap, and so the weight of the leg pressing down makes that kneecap a little uncomfortable. So a lot of times what I'll explain to my patients is, if you can get into close to end range extension in this position, laying on your side, straighten that leg, and then you can come down, it's a little more comfortable. Another option would be to take that same pillow you were using in the beginning, lay it up under the thigh. So now that kneecap can float in the air and it can move freely. This is going to get me just as much extension, but I feel like I'm still laying on the bed comfortably. What some people will do is they'll scoot all the way down to the edge of the bed. So again, now both my legs, I know they're hanging off camera, but are hanging into extension. My thigh is supported by the edge of the bed. My kneecap is not being compressed. There's no pressure on the incision. Problem with this is there's a lot of pressure on the knee. So preferable, better than this position, would be up on the bed, fold it over, pillow under the thigh, and we just relax right here. You know, I might spend 5 to 10 minutes in this position.